Should I start the presentation or
Uh,
do I need to
I'll
wait?
just give a short introduction and then you can go forward. Is it okay?
Yeah, fine.
Okay. Okay, so hello and welcome everyone. Very good afternoon and wish you all a very happy new year. So, welcome to the webinar on aberrations and the optical system. This informative talk will be delivered by Mr. Dhruval Parekh. He's a proprietor of Parekh Vision Care at Nagpur, Maharashtra, and he's working as a specialty contact lens trainer. Mr. Dhruval is an optometrist with B Optom from the prestigious Elite School of Optometry and has a good work exposure at Shankar Netralaya, Chennai. So let's move forward with the today's informative talk on the aberration and the optical system. May I now welcome Mr. Dhruval Parekh for the talk. We welcome you, sir.
Thank you so much, Devanshi. And let's start the presentation.
Sure, sir. Thank you.
Are you able to see the presentation?
Yes, we are able to see the screen.
Okay. So hello everyone, Happy New Year. And so today we are going to learn on the first day about the optical system and how the aberrations tends to affect the quality of image when you say it may be like you personally would be facing a lot of issues with the halos, glare, as well as your patients. So today we are going to address all these issues and how do we help. So the main objective of this lecture is to give you a gist of about the aberrations and optical system and not to make you bore and sleep. Okay, so let's get to the topic. Okay. So what do you see here? There are two different images that are present. Okay, in the first image, you can see a person who is there walking, and there are other two people. There are the trees that are present here, as well as the vehicles, the light. But are they very clear to you? Actually, you can just understand, okay, there is a person who is walking, there are trees that are present here, you can see some cars that are parked uh, on the signal, it's there. But you are not able to make a distinct image like, okay, this is the color of it, okay. So you are having an issue with it. So all these are type of operations which are present, which creates a lot of confusion and problem for the people to understand when they are having this kind of issues. In the second image, also you can see that there are so many cars that are parked, the street lights are present, but it is giving some kind of the aberrations. So when do we face this type of problems? There are several ocular conditions where we face this kind of problems. So mainly, like we see the cataract. Cataract is one of the ocular condition where you will be having the blurring of the vision for the patient, as well as like they will be complaining when I'm doing a night driving. When they're driving at the night, they will be facing a problem of the halos. They will say a lot of glare is there. So that is one of a very big complaint that is presented by the patient. So definitely the management, how it goes, we grade the stage of the cataract and the ophthalmologist take a call to operate and implant an IOL. So that is one of the ocular condition. We have the other ocular conditions where we have a lot of corneal irregularity that can be in the form of the keratoconus or it can be keratoglobus. We do have post-LASIK ectasia conditions as well as the ICL implant. Is it audible now? Okay. So like when you have all this kind of the like implantable polymer lenses, although if it is there, we get a very good quantity of vision. We can get the patient on this Snellen chart and see like they will be able to see 6:9, 6:6, or everything. But are they able to have a good resolution of that? Are they able to resolve that images clearly? That is very much important. So it is like the quality of vision is also very much important along with the quantity of vision. So we usually solve all these issues. Now, it's not just that you give us spectacle correction and the refractive error and it gets solved. No, we need to give them some kind of the lenses that can be a rigid gas permeable lenses or the scleral lenses that we give to the patient. And it is very important that we do a trial for them. So when we show them at the night how it improves the quality of vision, that gives you a call to whether go for it or not. So these are few conditions. Apart from that, the way we have a lot of conditions like myopia, hyperopia, astigmatism. These are also the conditions where we have the aberrations. These are considered to be the first order aberration. What do we do in that case is like when we wear these spectacles, if you are having a spectacle, when you move your eyes to the periphery, you will be seeing a lot of disturbances. It is not like the very clear image that is present, but in the center, it is a clear image. So this is the first order aberration which is present. When you move your eyes, you are having the disturbances on your periphery. So this is also a type of aberrations. And we will see in the next slides how to overcome it and to solve it. So what are aberrations? By the definition, it goes in an ideal lens, light from any given point passing through the lens would form a single point image in the image plane. So contrary to the real, in the real lens, we have the issue that it doesn't form a point image, whereas we have some kind of the disturbances that are present. So just understand when you are standing on a road and you are seeing the street light, when the light passes through that and through your crystalline lens, it is not able to form a clear single image on your retina, and it is not interpreted, comprehended by your brain properly, and it gives a some kind of blur image. So these are the aberrations that are present. So mainly there are two types of aberrations which are there. One is a chromatic aberration and one is a monochromatic aberration. In case of the chromatic aberration, it is usually caused by the presence of the white light. So it is in our like daily life that white light is there, and when it passes through your lenses, it causes some this type of image where you can see in this image there are no halos that are present around or like the color fringes, but here it is there, yellow, blue, pink, all these colors are present. So this type of fringes are usually appreciated by the patient and which causes a lot of disturbances in their daily life. So what is the reason for them? Like why do they have this? So it is like mainly related to the Abbe value of the lenses. So we will be discussing about the Abbe value, and we have another type of the aberration which is called the monochromatic aberration, which is caused when we have only one particular wavelength of light. When there is one particular wavelength of light that is present, we have these five type of aberrations that will be rising up. So let's discuss about the chromatic aberration in detail first, and which will be followed by the monochromatic aberrations. In case of the chromatic aberrations, we have two types. It is longitudinal chromatic aberration, and we have the another one that is the lateral chromatic aberration. So what happens in the case of the longitudinal chromatic aberration? You can see here, when an object that is present here on the axis, when the rays of the light are passing, it is forming the images at two distinct points on the axis. Okay, so the blue light is has a focal length and focuses in front, whereas the red wavelength gets focused at the back. So the difference in the distance between these two images results in the formation of the longitudinal chromatic aberrations. Whereas in the case of the lateral chromatic aberration, when the object is present here, it gets focused and forms two different images here. This is a blue image that is being formed here, and this is a red image that is being formed here. So the difference in the distance between these two images in the size results in the formation of the lateral chromatic aberrations. So when does the chromatic aberrations reduce the visual acuity for the person? So it is very important. Okay, theory is that like this causes a lot of problem for the patient, but how does that happen? It needs to be understood. So if you are wearing a spectacle, okay, this is the spectacle and you are looking straight through it from the optic center, you can see that there won't be any kind of the aberrations. But when we move our eyes a little bit, okay, it causes the prismatic effect to be induced. When this prismatic effect occurs, it results in the creation of the dispersion of the light. And this dispersion of the light results in the chromatic aberration, which is correlated with the Abbe value, what we were discussing. So when we have the normal CR39 lens that is present, there are three types of lenses which are there. CR39, polycarbonate, and high index lenses. In high index lenses, we have 1.6, 1.67, 1.74. When these high index lenses are present, there will be some kind of the aberrations which will increase as compared to the CR39 lens, because there is an increase in the Abbe value of the lens. Okay, so what happens? Now you are moving your eyes through the high index lens. Okay, so there will be a lot of chromatic aberrations that will develop in the high power lenses. So we need to control this. This is controlled in several ways, but if you are having high index lenses, you can go for anti-reflection coatings that can reduce it. So the higher the chromatic aberrations, there is a presence of the low Abbe value of the lens. So polycarbonate lenses, high index lenses have low Abbe value, which will result in more chromatic aberrations. The lower the Abbe value, the faster the reduction in the relative visual acuity in the periphery. So now what are the ways to reduce these chromatic aberrations that we are seeing? So the main way to reduce is to use the monocular interpupillary distance, which we have to measure. What do we do is like when we take the measurement, it needs to be done perfectly. It's not like we just take binocularly and all. You have to occlude one eye, make the patient sit at the perfect level, eye level, and take the interpupillary distance measurement. Okay. So once that is made, we can see that the optic center is aligned with your visual axis, which will help in reducing the aberration. Apart from that, it is important to use the shorter vertex distance. Now, why do we concentrate on using shorter vertex distance? It is very much important because when you keep the spectacle a little bit far from your eye, the area will come into the center, like the peripheral area will also come closer to you. So the aberrations will increase. But when you move it too close to your eyes, the side of the lens will go a little bit farther away, which will provide you a more comfortable area to see. So in the case of the contact lenses, when we see, we have around a distance of like reduced from 13 mm. It is very close to your cornea, and 13 mm distance is reduced. So when you move your eyes in any of the position, okay, the optics of the contact lenses is always aligned with the visual axis. So we don't have that kind of the aberrations that are developing. But in case of the spectacles, when we move our eyes in the periphery, it's not, the optic center is not moving along with your spectacle. So it tends to create a lot of aberrations. So when you move your head, you will be able to appreciate a more clearer image as compared to when you are seeing from the periphery of the lens in the straight gaze position. It is also important that we have a sufficient pantoscopic angle for this spectacle that is being manufactured. If you have a spectacle which is straight like this, okay, the lens thickness will be more in the high power lenses, -6, -7, if you take for an example. In that cases, the thickness of the lens in the periphery is more. So when you move your hair, just move your eyes down, you will be seeing from this lower part of the lens. What will it cause? It will cause a lot of aberrations when you are seeing an object in the near. In fact, if you are seeing your mobile phones, you will be seeing some fringes around it. So that can cause a problem. So if you have a proper pantoscopic tilt, if it is bent a little bit, not more than 10 like that, then it will help you to have a more closer vision from your optic center. Apart from that, we have the we need to see about the edge thickness, what I have discussed, and we have the achromatic lenses. So what happens in the case of the achromatic lenses? In case of achromatic lenses, we use a plus power and a minus power lenses, which are combined together to form a system of lenses, where the plus lens and the minus lenses are made from the different material. They are not of the same material. They will be used of the different material, which will result in the reduction in the chromatic aberrations. So before going to the monochromatic aberrations, so what we have seen is like in the chromatic aberrations, we have longitudinal chromatic aberrations, lateral chromatic aberrations. Along with that, we have the Abbe value, and we have the ways to reduce this chromatic aberrations. So these are the four things that you have to keep in your mind. We do have the equations to calculate about these chromatic aberrations, which you can study from the books. It is very well given in that. So now when we discuss about the monochromatic aberrations, we have distinctly 5 types of aberrations which are given by the Seidel. So it is in the form of the spherical aberrations, coma, astigmatism, curvature of field, and distortion. So let's discuss one by one for spherical aberration. In case of the spherical aberration, this is the first aberration of the like in the Seidel. And when does that happen? It happens when it is like the object is on the axis. So spherical aberrations are only caused when it is present on the axis. Okay. So here is your object, which is placed on the axis. We have the parallel rays that are passing through the surface of the lens, and it will be focusing at one particular point here. Whereas the peripheral rays that are passing through will get focused in front. Okay. So they have a different focal length and are being focused at 2 different points. So what will happen is that this will cause a resultant in the blurring of the image. When this happens, it is called the spherical aberrations. And we take the center of the both, and we find a circle of least confusion. Like this is a point where it is like neither too blur nor too very clear. Next is the Seidel aberration is the coma. So what happens is, here you can see the object was on the axis, whereas in this case the object is present off the axis. Okay, it is at a particular distance from the axis. So now when it is forming an image, you can see the peripheral rays gets focused somewhere here, whereas the rays passing through the center of the lens gets focused at this particular point. So this is not being again focused at one particular point. The rays are being focused at the different levels. Why does that happen? It is actually because of the layers of the lens that are present. You can see the thickness of the lens varies as we go from the center to the periphery. When that happens, the rays that passes through the central part has to go through the various different layers as well as the periphery. So the magnification of the rays differ, and they form the images at distinct points. When this happens, it results in the formation of an comet or ice cream shape of an image. So that is called the coma. Then the third one is about the oblique astigmatism. So this is like an astigmatism where you can see it will be forming 2 different images. So you have your object that is present here. The light will be passing through the lens and it will focus at 2 different points. One will be at the sagittal plane, one will be at the tangential plane. It results in a formation of the structure like a T and cup and saucer form of an image that is formed. So every point will be like this is the object. Every point will be having a distinct images that are formed over the surface, where the tangential images will be in front, sagittal will be at the back. Like that, it will result in the formation of image, which is a little bit irritating. So we have the ways to reduce this oblique astigmatism, which is usually done with the help of deciding the base curve of the lenses. I will explain you about the base curve of the lenses. But when we decide the perfect base curve, what we need to give for a particular power of the lens, it results in reducing the oblique astigmatism. The third serial aberration, which is the oblique astigmatism, is also associated with the another aberration known as the curvature of the field. Either we have the curvature of field as an aberration, or we will be having the oblique astigmatism as an aberration. That we need to keep that in mind. Okay, so what happens in this curvature of the field? This is the fourth type of serial aberration. It is a solution to the third aberration, that is the oblique astigmatism. In order to get rid of that type of an image which is being formed by the oblique astigmatism, we get the curvature of it. Now, what happens in this? Here you were able to see the two different images that were being formed. This is one, and this is the second image that is being formed here. Now, in case of the curvature of field, it brings the tangential image and the sagittal image that were being formed in the oblique astigmatism. They coincide and make it as a one point. And when we are doing this, this object will look like a curved surface that is being formed. The image will become like a curve. You will be seeing a little bit of curve type of image in that case. So let's take an example. If you are wearing a wraparound type of a goggle and all, you will be seeing a slightly curved images. So that type of an image is formed. And when the surface that forms this type of image is known as a Petwell surface. The last type of the serial aberration that is present is the distortion. So what happens in the case of the distortion? It is like you would, if you would have seen any of the patient like with coming with the high thick lenses, which is usually present in the cases of aphakia. So in the case of aphakia, they will be having the thick plus power lenses that will be present. So what happens in that case is, whatever the object that they are seeing, they will be seeing like slimmer. They will be like moving in. So that's a pincushion effect. You can see this. Everything is moving in. That type of an effect is created in case of the plus lenses. Okay. If you would have visited any of the science museums, there are different mirrors that are present. There, if you stand in front of that, you will be seeing yourself as a little bit fat, or it may be slim, or your height will be increased. That type of effect that we see in the mirrors is usually created by these lenses when they are worn in front of your eyes. So you can also simulate this type of condition where you can wear a -10 power lens, which is easily available. And in the trial frame, you can put the same amount of lens, +10. And you can appreciate that effect that will be present. So when you are seeing the object present there, it will be looking like this pincushion. And though you can get a very good acuity 612, 6.9 for these patients, but it is at the end of the day quantity plus quality that results in a good vision. So the quality is hampered in this case. So let's get to the summary of all the 5 aberrations that we have known from the monochromatic one. So we have the spherical coma, oblique astigmatism, curvature of field, and the distortion. These are the aberrations that are present, which depends on the form of lens, the axial rays, oblique rays, small aperture, large aperture, and affecting definition. So what's affecting definition? It is like the one particular image is present. Is it forming a kind of certain different type of image, or it is like a same image that is being formed? Form of the lens is like the material that we are using, the type of the lenses that we use. So if it is any kind of the lens that is present, there will be presence of all these 5 aberrations. When the rays are axial, like the parallel rays when they were present, it will result in the formation of the spherical aberrations. In the parallel rays, there will be only presence of the spherical aberrations. But when we move to the off-axis rays, that is the oblique ray, it will result in the formation of all the other 4 apart from the spherical aberration. When we go to the size of the aperture, so like we have a small aperture pupil that is present, so it tends to block the peripheral rays from entering. So we don't face any kind of the spherical aberrations or the coma. but we have to deal with the oblique curvature and distortion that we see. In case of the large aperture, when it is present, you will be facing all the five operations. Whereas in the case of the image size and all, there is a difference in the image size that is being created in all the other apart from the distortion. So now when we have to design these spectacle lenses, we have to keep in mind that there are three main types of the aberrations that we have to deal with. So it is an oblique astigmatism, it is the power of the lens. What is the power error? Power error is curvature of field and distortion. These are the three things that we have to deal with. So lens that can correct the oblique astigmatism, the tangential and the sagittal images that we were seeing. The difference in the distance between the tangential and the sagittal is the astigmatic error that is present. So when we try to correct that, correct the oblique astigmatism, leaving the power error. What is that power error? It is the curvature of field. What we had discussed, if you try to correct for the oblique astigmatism, it will result in the formation of the curvature of the field that will be there. So the curvature of field, when it is formed, it is known as the point focal lenses being designed. In case if we are using a lens design where we are able to correct for the curvature of the field, then in that case, the residual astigmatic error that will be left behind will result in the formation of the oblique astigmatism, which is known as a Percival's form of lens. In case if we want to use a cocktail of these lenses, one if you want to use a point focal also and Percival, then that is the minimum tangential error form of lens. What happens in that case? It is a combination of a point focal and the Percival's form of lenses that we use. So these are the three types of lenses that are considered to be the best form lenses. So how do we control that? The four variables for the lens design to be controlled is the vertex distance. If we move it closer, it is much better. The lens thickness of the lenses, the refractive index that we are choosing, is it 1.5, 1.56, like that. And front and back surface of the lenses. Now, what's this front and back surface of lenses? How does that affect? The front and back surface of the lenses is mostly correlated with the base curve of the lenses. So we are now deciding on the base curve of the lenses in order to control the aberrations. How do we decide on the base curve of the lenses? So actually there can be an infinite ways to calculate the power for the base curve by deciding the front surface and the back surface. Just to make it simple, let's take if it is a +6 and -4, +6 is front surface, back surface is -4. The resultant will be +2. So that is the power of the lens. So like that, it is like power of the lens is decided, though we have a lot of technicals in that. But this is the way you can decide on the power of lens. So that combinations can be several combinations you can make. But we need to make like the perfect calculations so that we don't have the aberrations. In case if the base curve selection goes wrong, it will result in a power like you won't be able to see from the center as well as you won't be able to see from the periphery, creating a lot of irritation for the patient. So manufacturers have come up with some guidelines to decide which base curve to give in case of one particular power. So they have used, like one of the example of this formula is Vogel's formula. Vogel's formula is used to calculate what would be the base curve of the lens. So for the plus lenses as well as the minus lenses, we have the different formulas. So base curve of the lens is equal to the spherical equivalent plus 6 diopters. So now let's take an example. If you have planar power, you want to make your anti-reflection lenses without any particular power. So in that case, what is your refractive error? It is 0 diopters. So you put in this equation, the spherical equivalent plus 6 diopters is equals to 6 base curve, 6 diopters base curve. So in this case, you are going to make a lens which is having a base curve of 6. Whereas now you are having an equation where like +2 is the spherical power. You are having a cylindrical power of, let's say, -2 in this case. So what is the spherical equivalent in this case? Spherical power +2, cylindrical power -2. So it will be -2 by 2, that is -1. We have the spherical power +2. So it equals to be +1. So now you put that +1 in this equation. So +1 plus 6 is equals to 7 diopters. So the base curve of the lenses in this case will be 7 diopters. Now what happens in the cases of the minus lenses? If you are having a power of -2 with -2. So first it will be -2 by 2, that is -1, -1 and -2, which will be equal to -3. Now you put that spherical equivalent -3 here in the numerator, and we have the denominator by 2. So it will be equal to -3 by 2 minus 1.5, which will be equal to 4.5. So the base curve of the lens will be 4.5 diopters base curve. So now what are these aspheric lenses? Aspheric lenses are a way in order to control the aberrations. Now that is considered to be a cone which is present, and we take the various segments of the cone in this. So consider this to be a cone where we are taking a circular portion from this. This is an ellipse portion, parabola. These are the cuts that we make in a cone to understand. So what does it really do? So aspheric lenses are those which will be having the astigmatic power that will be calculated for every point in order to solve the oblique incidence of the ray. So just to make it easy to understand for you, okay, you are wearing one particular spectacle. Okay, from the center you are, it is like in the pupillary distance has been taken and an optical center has been calibrated for that. So we are wearing a spectacle with the optical centers with coinciding with the pupil. So when we are looking straight, we won't be having any kind of the aberrations. But when we move our eyes, in the case of the aspheric lenses, it is made in such a way where the oblique astigmatism will coincide with this astigmatic point, which is the focal length. Focal length is calculated in that way. It coincides, just reducing your aberrations. So that is the role of the aspheric lenses. Let me, if you would have studied first of all, it used to be explained like in the case of the astigmatism, if you are seeing through the window, you will be seeing it curved. Yeah, it will look like a curve for you. So when you use these spherical lenses, it will appear curved. But in case of aspheric lenses, when you are using them, this curved surface will start becoming straight. Though it won't become completely straight and look like perpendicular, everything, but it will look like if it is becoming straight. This is the role of the aspheric lenses to get you into that, to improve the image quality. So what are the advantages of using the aspheric lens form? It reduces the thickness of the lenses as well as the weight in case of the high power lenses. If you are -6 or +6, that type of cases, it helps in reducing the thickness as well as the weight of the lens. So you don't get the marks here, one of the things. Also, when we are seeing the off-axis, like the oblique astigmatism, curvature of field, distortion, this type of the off-axis rays, when they are passing, it helps in controlling them, providing you a good quality of vision. It reduces the spectacle magnification and controls the distortion. So the person doesn't look fat or person doesn't look very thin. So, like as we had discussed in the beginning, like we in the various ocular conditions, pathologies, we have a lot of patients complaining of the glares, halos, and all. So now there is a protocol that is developed in our by Sir the polynomial. It is said. What does and that happen is like before operating a patient for the LASIK, they usually measure the aberrations that would be possibly developed if we are operating the patient, and are there chances of development of the post-LASIK ectasia. In case if the post-LASIK ectasia would be developed and there would be aberrations for the patient, then we don't go ahead with the surgery. So in case if we are having this fourth aberrations, spherical aberrations and others, and fifth to 10th category of the aberrations that are being formed, then in that case, we don't usually undergo a surgery for the patient because it would be difficult for them to have a good quality of vision. So this is the theory or which we have in the systems now to understand whether for patient we need to undergo a surgery or not in order to avoid for the operations that would develop. So this is the like the crux, like what happens in the optics and what are the operations that we face. So yeah, thank you.
Thank you so much for this wonderful presentation.
Yeah, thank you so much.
I would like to request the students to unmute yourself and ask the questions. So instead of using the chat box, you can unmute if you have questions and you can directly ask to the speaker.
Why chromatic aberration image is colored?
Sorry, can you come again?
May I
Why
repeat the question? Do you want me to repeat the question?
Yeah, yeah.
The question is why the image which we get because of the chromatic aberration is a colored image.
Yeah, actually, it is like in like everyday life, you are having the white light that is present. This white light will be comprising of the components of Vipure. So all the five components which are present, when it passes through the prism, just if you would have seen from the prism, when it gets dispersed, it will be giving various wavelengths of the light. Similarly, when from any refracting surface it passes, if you see this lens, it is also a combination of two prisms that are present, which gets scattered. The light gets scattered, and it results in the formation of the each wavelength will be focused at a different point. So when the blue rays get focused in front and the red light gets focused at the back, so there is a difference in the point. They don't coincide at one particular point. So that results in the development of that chromatic operation, and we see the colors, different colors that are seen.
Thank you,
I've
sir.
got a question.
Yes, Trevor, you can go ahead with your question.
My question is that does chromatic aberration, does it increase with pupil size?
Yeah, actually, the size of the pupil will be a matter. Like if you have a larger pupil size, the amount of the aberrations will increase. So you won't be able to like appreciate like okay, it's not a way to quantify that, but definitely the size of the aberrations will increase along with that.
Okay, thank you.
Any other questions from the student side?
Yeah, just one more question to confirm something.
Please go
Yeah.
ahead.
Am I correct to say that chromatic aberration does not occur in monochromatic light?
Yeah. So chromatic operations are different as compared to the monochromatic because monochromatic has only one wavelength, whereas the chromatic will be having all the uh, components of the white light. So that is completely different.
Excuse me, sir. Is the images formed in chromatic operation in different focal length? Is this because of different wavelength?
Yeah. Yes. So like every particular light has one particular wavelength. Because of that only this issue is coming.
And sir, what is the circle of least confusion? At what condition this is formed?
See the circle of least confusion you can see in the duochrome. that you use. In that also we have that. Circle of least confusion is used like a place to solve like when you're not able to get a particular focus of the light for the patient. It is like blur this side and that side also. So we try to get a quality of image for the patient where we are trying to solve the issue. And the same thing is used in our duochrome principle also, where red and green light that we use.
May I interrupt, please?
Yeah.
His question was actually why is that happening? He wanted to ask if you could explain it again.
No, actually, the thing is when the light passes through the surface of the lens, the rays which are parallel to the lens, okay, they are being focused at this point, whereas the peripheral rays get focused in the front. So it is like we need, it is not one particular point where both the lights are being focused. So we require this is the circle of least confusion where both are like, it is a medial portion of the rays where it is being focused.
Is that understood, Rakesh, or you want to ask something else?
Yes, I'm understood.
Okay, great.
Hello, sir.
Yeah.
Ask me one questions. How do your operations occurs in the eyes, specifically of the axis and on the axis?
Sorry?
I
How
would,
do
Sanam,
operations
I think I would repeat your question from your side. Should I interpret the question?
Yeah.
His question is, how is there a difference between the off-axis and the on-axis aberrations? Or what is the difference between those two? Or when will you call it as an off-axis aberration and on-axis aberration?
Okay. So just see this object. Like when you are saying, like, let's make it easy in real life. Okay. When you are sitting straight and looking straight, okay, just try to understand if the light is coming parallel to your eye level, that will go past through your optic center and it will be forming an image here, just in the same way. This is an on axis. Whereas the rays that will be traveling from a particular distance, like you just consider you are not moving your optic center or the visual axis is straight, whereas the light is coming from somewhere from the top. Okay, just you can take like that. So that is an off axis. It is not in the visual axis direction. It is from somewhere different direction that is coming. So when that happens, that is called as an off axis. Whereas when the light is parallel to your visual axis, then it is known as the on axis.
Okay, sure.
There are few more questions in the chat box, so I'm reading out it one by one. So the first question is from Adil. If he would able to get this content. So for Adil, I can answer your question is you can go back to your Facebook Live and view the videos. The another question is from Neelkant. If you could please explain aspheric lenses again, just the meaning. And the next question is also interlinked to the aspheric one. The question from Sunil is, how does the spherical aberration get worse?
Okay, so in the case of the aspheric lenses, what happens is like you just considered it to be this is a cone, okay, or else let's discuss. When a lens is being manufactured, it tends to be a spherical lens. They don't consider to be having a different focal length for the surface of the lens. So if this is your lens, they will be having the same focal length overall complete surface. Whereas in the case of the aspheric, what they do is we have the optical center here. They will be calibrating the lens surface in such a way that the focal length will be different for each point on the surface of the lens, which will result in the light to be focused as a one particular point on the surface of your retina. So that is the thing which is an aspheric lens. You don't have the light getting like just what do we say, getting placed or falling on the retina in various random direction. It will help you to make it a single particular point on the surface of your retina. So these are the various forms of the cones that are being used in designing the lens so that the astigmatic, it is the type of an astigmatism only that is being used to manufacture the lens, that the oblique rays that falls on the surface of the lens gets focused to one focal length and forms one particular point image on your retina.
Thank you for that answer.
Nilkant, understood?
There are two more questions in the chat box.
Yeah.
May I go ahead with it?
Yeah.
So first one is
How does the
from,
spherical aberrations get worse?
yeah.
So it's like you can just, this is a very good understanding thing for the table wise. So when does it get worse? When the size of your aperture increases, then the spherical aberrations will get worse. As the size of the aperture increases and more of the on-axis rays are there, so that's the parallel rays are more, it will result in the formation of the aberrations to be more. How can we reduce the coma aberrations in the lenses array-based imaging system? It's the size. So actually, like when you can see here, it is mainly caused by the oblique rays that are passing. And if we control the size, aperture size of any particular, like if you are designing a telescope and it is having a large aperture, that will result in the more amount of the aberrations to develop. But if we reduce the size of the aperture, it will result in reducing the amount of the aberrations in the coma. So it is the size of the aperture that is used for controlling any kind of the aberrations. How and when the prismatic effect occurs? So prismatic effect is by the dispersion of the light when it passes from the prism. It gets dispersed into the various components of the light based on the wavelength, and we see the various different components of it. Zernike polynomials. Actually, this is the very scientific calculations that have been done, and each operations will be having a one particular polynomial. Like there is a complete chart that you can see on in books or as well as on the Google. So what happens is like this is the plotting for the particular operations. When we have the first order operation, second order operation, it is possible to correct them with your spectacle correction or some kind of the other like the lenses form, normal lenses. But in case if you are operated like this Zernike polynomial is just to see whether you are operated or undergoes a surgery, will there be a presence of the higher order aberrations? In case you are developing this higher order aberrations, 4th, 5th, and till 10th, in that case, you will be requiring some kind of specialty lenses or way to resolve that.
Okay, I think the next question is again repeated. The question from Shweta is, which aberration falls on the on-axis and the off-axis? So I think you have already explained that again.
Yeah. What
Moving
could be
on
the
to-
way to reduce the aberrations if the patient is having large pupil? So in that case, what we can do is there we have some contact lenses, maybe like a we can say the type C lens or cosmetic lenses that we have in the market, where we can give it to the patients, where it will be having the small pupil size. So that can be customized and made into a small pupil size for the patient, and we can give them. So that will help in reducing the aberrations. So in the case of aniridia, where they will be having the large pupil size. The iris is a little bit missing. So in that cases, if we give this type of the contact lenses to the patient, it will help in controlling the amount of the light that is passing through. Treatment of the chromatic aberrations. So this is the thing you can see in the treatment of the chromatic aberrations that are present. Ways to reduce the chromatic aberrations. So use the monocular IPD, short vertex distances. These are the things that you can use to get control of the chromatic aberrations.
Most of them have a similar question, that how the
Yeah.
on-axis aberrations occur in the eye, and does the aberration increase with the pupil size?
Actually, the on-axis aberrations are we don't have the spherical aberrations usually in when we are dealing. You can just see this. Yeah, this chart. This is the complete answers are in this only. We don't have such big apertures. So the size of the pupil is small, which does not allow the light to pass through. On-axis aberrations won't happen in our case because the peripheral rays are being blocked. So in normal eye, we don't have this type of issues coming.
Okay, I think that answers most of the questions.
Yeah.
And I think one more question from Santoshi is, which type of lens is used in aberration? So as
It is the
discussed,
best form lenses. These are the lenses that which is recommended. Maybe it is like scientifically more present in the labs as compared to the normal daily lives. So main ways to what is available in the market is aspheric lenses we do have in the market that can be used.
and
What is the best
last one more
analogy
question
for
left.
what happens to light in chromatic aberrations? Miss, you want an example or
Kamod, could you please unmute and ask the question?
example?
So it is the
Related to eye or
example.
not related to eye? Analogy. Okay, so you just see this image. What we use in the filters on Instagram, same thing. It's the same way. This type of image that is being formed because you don't have cataract, so you cannot appreciate that. But when we have this type of uh, you can see these fringes that are present around, or like when you see a particular light, you see the rainbow colors around it, or when you like press your eye and just open it, you will be seeing some rainbow colors around a particular light source. That type of operations are chromatic operations.
Okay, I think that answers all the questions. Any more questions left from the side of students? Any questions, any confusions?
No, ma'am.
Okay, great. Jyoti has to ask a question. Okay, great. One more
Thank you.
question
Thank you.
I'm receiving through the chat is from those who are not able to join through this is, how do you measure the aberrations?
We have the abrometers that are present, which can measure the aberrations, and that is like the higher order aberrations. We can just that machine abrometer, Shackman is the instrument that we use to measure the aberrations for the higher orders.
And one
Yeah,
more
corneal irregularities is the main cause for this type of aberrations. So when you start your practice, you will be having the keratoconus patients who will be complaining about this type of images. So you have to deal with that. You need to give them some type of the lenses that are rigid gas permeable lenses or the scleral lenses, which gives a very good quality of vision for them. So yeah, corneal irregularities any kind will result in formation of this type of images.
Okay, thank you so much, Ruel, for patiently answering
Yeah,
all the questions.
thank you so much.
Maybe if no questions, we are moving towards the end of the session. So a big thank you to Mr. Dhruval for the informative and the interesting lecture, and also patiently answering all the questions. I'm thankful to the principal, Mr. Hemant Pattadia sir, for the permission and support to conduct the webinar. Thank you to Ms. Dhruvi Patel ma'am, who is the in charge of the webinar team from Department of Paramedical and Health Sciences, for helping to conduct the webinar. I would like to thank the Parul University webinar team, without whom this informative session would not be possible. Thank you for your support and bringing this optometry students as well as practitioners at the same platform for this session throughout India as well as abroad. And last but not the least, thank you to all the students for joining in and making this session as an interactive session. Hope you people gained a lot from it. Thank you so much.